Good evening, everyone. I'm Dr. Shailaja Kale, and we are just having a small kind of a brainstorming on the burning issues of diabetes dilemma. And today we have a very interesting topic. As everyone is aware, diabetes dilemma, we have a www.diabetesdilemma.com where one can visit all the recorded videos of the past scientific programs and even a list of upcoming programs. We do also have a YouTube page of diabetes dilemma, and there are some videos we upload. Today, it's a very interesting topic, and I am very happy that I welcome our expert today is Dr. Sujit Chandratraya, and he's an endocrinologist with very much academic interest in every aspects of endocrine, diabetes, and obesity. And so, definitely, I assume that his comments will actually enlighten us. What I'm going to do today is just some simple baseline issues about endocrine disruptors that I will be talking for say 10 minutes. And then we will have expert opinion from Dr. Sujit Chandratraya, endocrinologist from Nasik. So let's visit some basic concepts of endocrine disruptors and diabetes. What I remember in last, say, right from 2017, every American Diabetes Association, there is a whole 4 hours workshop on this topic of endocrine disruptors. It actually mainly in gestational diabetes, there are lots of papers published. That's how I got interested. And then I started visiting these kind of day programs in ADA. And now it's a talk everywhere with a lot of publications. So, what are endocrine disruptors and what is their importance? We know that diabetes is a chronic, lifelong, and incurable disease. And the number of people with diabetes and also pre-diabetes, IGT, are increasing globally, much more in South Asian countries and in our country, India. A South Asian or an Indian person with type 2 diabetes will have very high cardiovascular risk. He has a very high chances of dying because of heart attacks and also the number of heart attacks compared to any white Caucasian person from Europe. So we have more kidney disease with our type 2 diabetes. So type 2 diabetes is basically a disease of blood vessels and affects every organ of the body. We have this concept of thin fat Indian where we know that it's not only insulin resistance but more of a beta cell dysfunction which actually prevails more in Indian type 2 diabetes. So why it is increasing in India? We always talk to the people and we say, okay, change your lifestyle. And then we say we have genetic predisposition. I think I have a fortune enough that I was a part of the publication of TCF7L2 gene and FTO, which how it is predisposes Indian population for more type 2 diabetes, published from KM Diabetes Unit with Dr. Yajnik. And also his work talks a lot about epigenetics, that over the generations, our genes are exposed to a lot of changes in the environment, and these environmental factors change our gene function for the wrong way. And this change in the gene function gets inherited to the next generation. So the gene structure may remain same, the function is different, and then the rates of diabetes and obesity or central adiposity, they increase in the generations. And that's how this present generation, we are seeing people with diabetes at the age of 25, 28, 29, and then I feel very sad when I have to say, no, no, it's your wrong lifestyle. So what is the wrong lifestyle for a person who has just graduated and working for 2 years? So it's a big question mark. It's not only lifestyle that we know. Central adiposity again is a big problem, that ectopic bad fat which is there in the liver, in the pancreas, around the blood vessels, actually disrupts that from the hepatocyte to the beta cell, that enteroendocrine axis. And we know that these are the two sides of one coin, and then it increases the rates of diabetes. So, though we are not obese, we do have more ectopic and the bad fat that is called as central adiposity. High carbohydrate diets. That is one more reason why type 2 diabetes is much more. And across India, whether it's south, whether it's north, whether it's east, whether it's west, we have more than 70% carbohydrates in our diet. And When I say carbohydrate, these are not complex carbohydrates, what we can see, which are taken by actually people who are in remote islands and they do not have diabetes, but simple carbohydrates, which are bad. And so, this kind of a diet again increases our chances, the numbers of type 2 diabetes. Sedentary lifestyle, we know work from home culture, sitting, our day to day life, we do not need to walk unless we decide. So unless we decide I want to walk for 1 hour, then only we walk. Otherwise, our day-to-day life doesn't need walking. That's the biggest crime and the bad thing which has happened in our lifestyle. So we need to take efforts to walk. Otherwise, we can just sit all whatever 12, 16 hours and do everything. So it's not only exercise, but in our day-to-day lifestyle, we need some kind of a movement which are absent. And the smoking. So we all say, okay, stop smoking, lose weight, do more exercise. That's what we advise for the changed lifestyle. Now there is one more players which is increasing diabetes in India, which we are going to talk about it today, are the chemicals in our day-to-day life. We get exposed to increasing evidence is suggesting that environmental chemicals which are getting exposed every minute, and that is actually